The data shows that approximately 1 in 4 individuals in Wisconsin suffer from mental health and behavioral health issues. So it's evident that the HW Endowment should invest resources to support our communities in the hurdle of overcoming these issues.
This initiative was very different than prior grant projects because of the length of it, but also AHW's commitment to hearing local communities and aligning interventions with their local conditions.
At the HW Endowment, we knew that the complexities of tackling behavioral health in these communities was beyond any one organization to tackle on their own. Thus, the importance of coalition building in communities so that a group of organizations, along with systems within that community, could tackle these issues together.
Marathon County has the biggest geographical area in Wisconsin, and it is two very vastly different sections of the county. One half is rural and the other half is very urban. So working with both sides of the coin, it made it a little bit more difficult, but even more rewarding as that work evolved and we were able to get more counselors into those rural districts.
So our project was really elicited to work with both populations, particularly youth who are in grades 6 through 12, so high school, middle school age.
There are two coalitions that kind of support our work. The first one is Healthy Marathon County, which supports the health department, first of all, but also supports the work that the coalition does. They're kind of our backbone support as health educators that support us and are out there advocating for us and for our work in their own organizations. The second one is the Marathon County School-Based Counseling Consortium, which is made up of school representatives, local health officials, mental health clinics, and other mental health providers.
One behavioral health challenge that this project addressed was the lack of access to mental health care, specifically for students at school. One thing that parents have to do with their child when they go to a therapy appointment is drive across the county, which is the largest geographical county in the state of Wisconsin. By putting therapists in schools, parents don't have to take off as much time for work. Students miss less class time, and school is a place where many parents are receptive to care.
One of the mental health challenges that we found in Marathon County is the depression and anxiety rates that are high and are continuing to climb in our youth in our schools. Something that has kind of exacerbated this issue is COVID and having all of that social isolation, not being able to go into schools, not being able to see your friends, has really been detrimental on a lot of youth, as well as a compilation of many other things.
The original goal of the project was to decrease depression rates by 5% by the year 2022. Over time, COVID hit, a lot of things change in our world, and those depression rates continue to increase. Another piece we wanted to address was access to mental health care services, particularly in our western, more rural Marathon County for those students.
In some ways, their job got harder because right at the point where they should be getting traction, the job got a lot harder and the entire context shifted. And so I think some of that impact, there's going to be some variability in that impact from what would have been had we not gone through that experience.
I think one amazing success story is in Marathon County, and in all of their public schools, they have embedded mental health therapists for kids to be able to get therapy within schools. With their parents' permission, they are able to access their mental health care where they go every day. It reduces stigma, reduces all sorts of barriers, including transportation, not having to leave school to get therapy. It really breaks down a lot of what the barriers are between a kid and a kid getting that mental health care that kid needs.
It's always important to meet people where they are, and being able to go into schools and meet those students in a classroom in their school that they're comfortable with, and not make their parents take time off of work, and have them have someone in the school that they can trust is really important for those students as they go on to their adulthood.
This project has built a behavioral health system that did not exist before, which increases access to our more rural Marathon County school districts to receive mental health therapy services at school.
Our hope is that the resources and the capacities that have been built within the backbone organizations in each community, as well as those coalitions, will strengthen the communities and enable behavioral health strategies to live on.
ABH funding allowed us to guide the work. In public health, our role is to communicate and convene the public health issue, and in this case it was mental health, and that gave us an avenue to do just that.